this message. Hackers hit dozens of countries exploiting stolen N.S.A. tool. Ambulance staff at a National Health Service hospital in London on Friday. Several hospitals across Britain were hit by a large-scale cyber attack, causing failures to computer systems. Credit Anti-Rain/European Press Photo Agency. San Francisco hackers exploiting malicious software stolen from the National Security Agency executed damaging cyber attacks on Friday that hit dozens of countries worldwide, forcing Britain's public health system to send patients away, freezing computers at Russia's Interior Ministry and wreaking havoc on tens of thousands of computers elsewhere. The attacks amounted to an audacious global blackmail attempt spread by the internet and underscored the vulnerabilities of the digital age. Transmitted via email, the malicious software locked British hospitals out of their computer systems and demanded ransom before users could be let back in, with a threat that data would be destroyed if the demands were not met. By late Friday, the attacks had spread to more than 74 countries, according to security firms tracking the spread. Kaspersky Lab, a Russian cybersecurity firm, said Russia was the worst hit, followed by Ukraine, India, and Taiwan. Reports of attacks also came from Latin America and Africa. Continue reading the main story. Related coverage. UK Health Service, targeted in cyber attack, ignored warnings for months. May 12, 2017. Hacker leaks episodes from Netflix show and threatens other networks. April 29, 2017. Hackers use new tactic at Austrian hotel, locking the doors. January 30, 2017. Los Angeles hospital pays hackers $17,000 after attack. February 18, 2016. He's Bitcoin's creator, he says, but skeptics pounce on his claim. May 2, 2016. The attacks appeared to be the largest ransomware assault on record, but the scope of the damage was hard to measure. It was not clear if victims were paying the ransom, which began at about $300 to unlock individual computers, or even if those who did pay would regain access to their data. Security experts described the attacks as the digital equivalent of a perfect storm. They began with a simple phishing email, similar to the one Russian hackers used in the attacks on the Democratic National Committee and other targets last year. They then quickly spread through victims' systems using a hacking method that the N.S.A. is believed to have developed as part of its arsenal of cyber weapons. And finally, they encrypted the computer systems of the victims, locking them out of critical data, including patient records in Britain. The connection to the N.S.A. was particularly chilling. Starting last summer, a group calling itself the Shadow Brokers began to post software tools that came from the United States government's stockpile of hacking weapons. The attacks on Friday appeared to be the first time a cyber weapon developed by the N.S.A., funded by American taxpayers and stolen by an adversary, had been unleashed by cybercriminals against patients, hospitals, businesses, governments, and ordinary citizens. Something similar occurred with remnants of the Stuxnet worm that the United States and Israel used against Iran's nuclear program nearly 7 years ago. Elements of those tools frequently appear in other, less ambitious attacks. The United States has never confirmed that the tools posted by the shadow brokers belong to the N.S.A. or other intelligence agencies, but former intelligence officials have said that the tools appeared to come from the N.S.A.'s Tailored Access Operations Unit, which infiltrates foreign computer networks. The unit has since been renamed. The attacks on Friday are likely to raise significant questions about whether the growing number of countries developing and stockpiling cyber weapons can avoid having those same tools purloined and turned against their own citizens. They also showed how easily a cyber weapon can wreak havoc, even without shutting off a country's power grid or its cell phone network.